with our local pharmacies to offer additional clinics to our older students, and this will start at our school sites in December. This will allow our 5 to 11-year-olds to be fully vaccinated before they return in winter break. In order to maintain a safe re-entry to school, after following the Thanksgiving holiday, we are going to be running a testing clinic on November 27th from 9 a.m. to 1 p.m. at the Pasadena Education Center in the South parking lot. There's no appointment necessary. Again, thank you for being here, and I hope everyone has a happy, safe Thanksgiving. So with that, I'd like to introduce Congresswoman Chu, and she will be introducing a couple of our parents, and then we will have some questions and answers. Thank you.
Hello, I'm Congressmember Judy Chu. I want to thank you for joining us here today. I also want to thank, of course, Dr. Elizabeth Blanco, our Chief Academic Officer of Pasadena Unified School District, and Dr. Yingying Go of the Pasadena Director of Public Health, and our parents, our wonderful parents, Bhavna Mishra and Francisco Castro, and their children, and we'll be hearing from them and their experiences with this clinic. We just walked through the vaccination clinic and witnessed all these brave young children getting their shots, and then also being entertained with balloons and all kinds of bracelets such as this as their reward. I also watched all these health officers administering the shots, but being so empathetic and caring with these children. It was so incredibly impressive. And it shows that it's easier now than ever to get vaccinated against the coronavirus. And thanks to $20 billion for vaccine distribution in the American Rescue Plan and President Biden's $1.9 trillion coronavirus response plan, 2/3 of Americans over the age of 12 are fully vaccinated. As a result, we're seeing fewer hospitalizations and cases. But I should note, that's only amongst those who are vaccinated. Even as over 70% of the country has had at least one shot, you're not fully protected unless you're vaccinated yourself. And so now that children ages 5 and up are eligible, and that boosters have been approved by the FDA and CDC, my message to all of you is to get vaccinated. The past year and a half has been challenging for everyone, but especially for our young people who've had to adjust to remote learning and to being separated from their friends and teachers. And while their parents and older siblings have gotten vaccinated, they have remained at risk for contracting the virus. But now we get to turn the tide. The good news is here in Southern California, we're already ahead of the curve. Now, I have to really thank Dr. Go, because she has accomplished an amazing thing as the Pasadena public health officer. She's made sure that now 92% of those 12 and over have been fully vaccinated. And that means fewer hospitalizations and fewer deaths. But to end this pandemic and put a stop to new threats like the Delta variant, we still need to get the numbers up. And we need to make sure, especially, that our young people are vaccinated as we head into this holiday season and people get together with their loved ones for the first time in 2 years. So that's why I hosted today's event, so that we could dispel the myths about this vaccine and hear from those for whom the vaccine will be life-changing, parents and teachers who've had to live on the edge knowing that their children and students are vulnerable to infection. For those of us eager to end this pandemic, vaccination clinics like this are a sign of hope and a promise that we can return to normal. But I know that there are a lot of parents with questions, some of whom may even be vaccinated, today, but we want to know that it's safe for their children as well. And so that's why I'm so glad that we're being joined by Dr. Go, who will help answer any questions that parents might have about their safety or efficacy. I also encourage parents to contact their pedestrians or primary care providers if they have any concerns. So I encourage anybody who is able to get their vaccines. If you've already gotten your vaccine, please tell your family and friends and your loved ones and encourage them to get theirs too. Vaccines are safe, effective, and our best hope for returning to a normal way of life. Getting vaccinated can literally help save a life, so make an appointment and get yours today. And now I'd like to turn it over to Dr. Yingying Go, our Pasadena Director of Public Health and Health Officer. Dr. Go.
Good morning. I'm Dr. Yingying Go, Director and Health Officer for the City of Pasadena Public Health Department. I'm also a board-certified pediatrician and a mother of 3 children, a teenager who is fully vaccinated, and 2 younger kids in elementary school who have already received their first dose. I'm here to share the excitement and relief that parents and children have expressed to us ever since COVID-19 vaccine was first approved 2 weeks ago for children ages 5 to 11 years. Finally, we are now able to have our elementary schools, our sports teams, our younger family members all protected. Our clinics have been full of smiles and hope as families take this important step to keep their children and every other family member so much safer from serious effects of COVID-19 and so much more confident to be able to stay in school without disruption. The Pfizer vaccine was approved by the FDA and recommended by the CDC based on strong scientific evidence that it is safe and effective for children ages 5 to 11 years. This vaccine is 1/3 of the dose of the vaccine for people 12 and older, and like for other age groups, requires 2 doses 21 days apart. It was shown to be 91% effective in young children. We take steps every day to protect our children from preventable injury and illness. With this vaccine, COVID is now a preventable illness. We use bike helmets, car seats, seat belts, and pool fences. We vaccinate for many other diseases that cause harm to children. COVID-19 not only infects children as much as it infects adults, it can also make previously healthy children ill, even possibly needing hospitalization, ongoing treatment, or rarely death. We have also seen that children can spread COVID-19 to family members, friends, or classmates. Vaccinations can prevent this. When I'm asked whether parents should wait to get their child vaccinated, I explain that I didn't wait. The holiday season is here, and I want to make sure that every family member 5 and older is fully vaccinated because it is the safest way to celebrate. And we are ready to celebrate and see loved ones, but only if everyone is vaccinated. Waiting to vaccinate is like taking your child on a 5-mile drive and only putting the seatbelt on starting at mile 4. I also want to make sure that everyone knows that booster vaccine has been recommended for everyone 18 years and older. If you've been waiting or concerned that you aren't eligible yet, please don't wait any longer. With the gathering and travel that is expected to happen in the coming weeks, now is the time to get protected. Sign up now for a vaccine appointment for your child or you to get your booster online at myturn.ca.gov. Retail pharmacies, many doctor's offices, and the Pasadena Public Health Department are all offering these vaccines for free. If you plan to gather with people outside of your household or travel this season, please get tested for COVID-19 before and after, and don't go if you have any symptoms. We have free, easy, painless testing every day of the week in Pasadena. Information is posted on our health department website. If you have questions about the vaccine, please speak with your pediatrician or school nurse, or check our website or the CDC website for factual scientific information about COVID-19 vaccine, not rumors or misinformation on social media. Thank you, and we wish you and your family a very healthy and safe holiday season.
And now I would like to introduce our parents and their children. We'll start with Bhavani Mishra.
So, good morning, everyone. I am Bhavna, and she's my daughter Ashvi. She go to Longfellow Elementary, and I'm very happy that she got her first dose today, because like last 2 years, it was very stressful. And for my daughter, I am, I'm very active and careful, because I don't want her to get sick, and I don't even want anyone to get sick. So please, I request all the parents to go and vaccinate your child. It's good for your child. It's good for everyone around them and you. Thank you so much.
Thank you. And now we have another parent, Francisco Castro Gonzalez.
Hello. I just want to say that this is my daughter, Kylie, and then Max. My daughter attends Sierra Madre Middle School. My son attends Sierra Madre Elementary. And, they're the reason I get up every morning. I don't want to choke up, but they got their shot and we did it. We live by our experiences. And my mother passed away from COVID, and so did my grandmother. So I want to make sure everyone out there, I know it's very controversial, but think twice, do your research, and make sure you try to get your shot. You get your shot for everyone's sake. And, she did work for this district, for Pasadena Unified, and Dr. Blanco was her boss at some point. And I just want to say, just it's more or less not for yourself, but like for everyone around you. Thank you.
Oh my goodness, I'm so sorry to hear that happen to your family, but thank you for being so responsible with your children today. Really appreciate it.
Thank you.
And now we'll open it up to questions. Well, seeing that there are no questions, then thank you for being here. We really appreciate it. And we, again, send the message to everybody who can, please get vaccinated. Thank you all very much.